All right. Good morning, everyone. I think we've got about 4 more minutes to the afternoon, so planned that one perfectly. We are so fortunate to have 4 Medicare Advantage beneficiaries with us today. Yesterday, we went to the Hill and met with their congressional representatives. They shared a little bit about their personal story. We're going to share a little bit about their personal story with you today. These are also inaugural members of our newly launched Beneficiary Advisory Council. The aim of this council is to elevate the voices, experiences, and perspectives of Medicare Advantage beneficiaries to inform BMA's advocacy, communications, and research. To kick things off, I'm going to just ask to go down the line here, and if you could just tell me your name and where you're from. We'll start with Rob down here.
Yeah, my name is Rob Rasmussen. I'm from Milwaukee, Wisconsin.
I'm Kathy Banster. I'm from Sturgeon Bay, Wisconsin.
I'm Gregory Ballman. I'm from Sturgeon Bay, Wisconsin.
Stephen Hadfield from Matthews, North Carolina.
Awesome. Thanks all. Just to kick things off, I'm going to ask one question. If you could just answer it in a sentence or two. Why is Medicare Advantage important to you, and why did you decide to get involved in advocating for this program? Let's reverse things, and we'll start with you, Stephen.
I think it's important because, for example, I have a rare blood cancer. It takes care of all my medical bills. And the reason I advocate is I don't want other people to go through what I go through. I mean, I wouldn't want them in huge medical debt and all that.
Great. Thanks, Stephen. Greg?
I'm a newcomer to Medicare Advantage plan. This is my first year on the plan. It's been an incredible journey. It's been a learning journey. Like many people out there, seniors out there, I think a lot of people have a misconception that going on a Medicare Advantage plan that you're going to receive multiple bills in the mail from your providers, and it is not the case. And I would recommend it to anyone. It's a wonderful program.
Thank you, Greg. Kathy?
I've been on Medicare Advantage for a few years, and I switched from regular Medicare because I was paying monthly fees for services I didn't need, and I'm wanting to be advocate so I can help other people learn more about Medicare Advantage and what savings it is.
Thank you, Kathy. And Rob?
Yeah, I got into Medicare Advantage, and one of the biggest reason is peace of mind. I don't have to worry about my medical expenses. It's a fixed cost every year, and it makes it easier for me to do the things I love to do. Like you saw in the commercial, I play cards, I travel, I meet up with friends, and this just wouldn't have happened without Medicare Advantage.
Thanks for that, Rob. We're going to get into some individual questions. Again, Stephen, I'll start with you. I know how much you've talked about the importance of affordability. Can you share just how Medicare Advantage helps you access the care and manage the costs that you might otherwise find overwhelming?
With Medicare Advantage, you already know what your premium is. You don't have to worry about no copays. For example, I live in North Carolina. All my doctors are up in Boston because of my rare blood cancer. I have a 0 copay. I don't have to worry about anything when I go, no matter what tests they do. Or, for example, my one drug is $18,000 a month. Because of Medicare Advantage, it is 0 for me.
Great to hear. Kathy, you recently experienced a scary incident when you fell and broke your arm. How was Medicare Advantage there for you in that moment and during your recovery, and how is it helping you stay healthy today?
When I broke my arm, I was told that it was the worst break that the doctors or physical therapists ever saw. And they told me that I would never be able to drive a car or reach into the back of my body. But with the help of Medicare Advantage, I had 6 months of physical therapy. They were positive about my recovery, and I could do all the things that they told me that I wouldn't be able to do. And it keeps me healthy now by continuing to advocate for good physical health.
Great. Thanks for that, Kathy. And Rob, Medicare Advantage offers benefits beyond traditional medical coverage, things like vision, dental, hearing, even fitness and transportation. Which of these supplemental benefits have been most valuable to you, and why?
Well, a good example is my vision. Okay, I had a situation where I had to get special kind of glasses, and when I went to the doctor, it wasn't going to be covered according to that. But I immediately got a hold of my agent or broker, I think you call him, and he reconciled that, and everything was covered. And again, it just took the worries off of me and put it on someone else to handle the problems. And that's why I love Medicare Advantage.
Great. Thanks, Rob. We're going to stick with you for another question here. As you may know, there's a recent piece of legislation currently before Congress called the No Upcode Act. This act would essentially act as a cut to Medicare Advantage, making it more difficult to diagnose high-risk patients. From your perspective, how would cuts to the program affect you personally and your ability to get the care you needed? So we'll start with Rob again.
Yeah, I did some study on the no upcode, and it concerns me because it's going to drop my score for Medicare Advantage from probably where the provider would get $1,100 down to probably $800. If they forget to note that I'm obese or that I had a pacemaker, that could drop the amount. And if it drops $300, all of a sudden I'm paying either a higher premium or I lose some of the benefits like the vision or the dental. And that would be a big concern for me.
Thanks, Rob. Same question to you, Kathy. How would a cut to the Medicare Advantage program affect you personally and your care?
If there was a cut to Medicare Advantage, I would maybe have to pay more for the services that I receive, and I wouldn't be covered maybe for chiropractic care, which I need, and also vision and dental may be cut.
Thank you, Kathy. Same question to you, Greg.
Well, I would be devastated to see any benefits cut from Medicare Advantage plan. I think it would be a great detriment to our senior citizens to do such make such cuts to this program that is working today. It's working very well.
Great.
Personally, not sure.
Thanks, Greg. And same question to you, Stephen. How would a cut affect your personal care?
If a cut would affect it, I wouldn't be able to get all the necessary treatment I need. If you had to rob Peter to pay Paul, you would probably have to. If you needed to pay more for medical, you'd have to cut back on your food, your housing, or anything like that to pay for the higher cost of your medical care.
Great. Thank you, Stephen. One last question for the group. We'll go around again. I know we were just on the Hill meeting with your representatives yesterday. You made a very good argument for keeping the program strong and stable. But just to close things out, what is one message you would have for policymakers as a Medicare Advantage beneficiary yourself? I think we can start with Stephen as well. What do you want them to remember about you and the program?
I don't want them to cut anything. I want to either keep it like it is or go up, even give more benefits, because if you cut, it's going to hurt everybody.
Great. Thanks, Stephen. Greg, your one message for your representatives and policymakers out there, what would it be?
My message to all policymakers out there would be that you have installed this program that is working. It's working very well. Why would you want to change something like that? Hard to put into words. It's very emotional to me that this program needs to be maintained. And if any changes are going to be made, make some changes that will improve it and keep it there for us seniors, because it's a wonderful tool that we have.
Great. Thanks, Greg. Same question to you, Kathy.
I would like to tell our policymakers that this year, for the first time, I was recognized that I have a scoliosis condition, and the plan that I chose had a $900 debit card that I could use at the chiropractor, and no one has ever recognized that before, and I would like those type of benefits to continue or to increase.
Great.
Thank you.
Thank you, Kathy. And Rob, what's your one message?
As I told the political representatives yesterday, and I'll tell the policyholders today, You have created a great system. You have a system that incentivizes people staying healthy. For example, in my case, I needed to lose a little weight, especially after that dinner last night. But in this past year, between my doctor, dietitian, and I've lost 47 pounds. The important thing for that is that it was easy. It was relatively cheap to do that. I just got to go out and exercise and eat a little bit less. But it also shows that these companies are incentivized to keep you well, to keep you out of the hospital. And I think that's probably the most important thing that people forget about when they talk about Medicare Advantage, that it's there to try and keep you healthy and reduce costs, keep the insurance costs out, because if they can cut their costs, they don't have to put you in the hospital, they get some of that money back. So it's self-serving in a way, but it works. And that's the important thing I think I tried to bring up at the meetings yesterday.
Thank you for that, Rob. Just to reiterate, in my role as director of grassroots at BMA, I read these stories every week. Hundreds of stories come into my inbox. This is a small snapshot of the real life beneficiary experience. So we're so glad that they could join us today. Just give us another round of applause for our beneficiaries here.